Hi, my name is Leslie Ballou, and I am a graduate student with Bellevue University's Clinical Mental Health Counseling. And today, we're going to discuss disorders of female sexuality. 43% of women in the United States of America have a female sexual disorder. Female sexual dysfunction is when you have regularly occurring sexual issues that cause problems for you or your romantic partner. This includes sexual response, lack of desire, unachievable orgasm, pain during intercourse, can be random or every time, and typically involves multiple approaches to treatment. Some of the symptoms include having extremely low desire to have sex, sexual arousal disorder, which is where you want to have sex in your mind, but your body just isn't there. Orgasmic disorder, where you're sexually aroused, but you can't come to climax. And then sexual pain disorder, which is where you have pain during sexual intercourse. Some of the causes that come with this are physical, such as health problems and medications. Other problems include hormones, which are including low levels of estrogen. Psychological issues that can cause this are depression, anxiety, long-term stressors, culture, religion, fear of pregnancy, or sexually transmitted infections. This can also happen with antidepressant medications as a side effect. Some treatment options are cognitive behavioral therapy, such as challenging negative thought patterns and behaviors, mindfulness therapy-based therapies, which is staying in the moment by paying attention to their body and limiting anxiety, behavioral therapy, such as sensate exercises, psychoeducation on sexual response, and communication training between partners, as well as couples therapy and hormone therapy. Some other things that can help with this disorder are lifestyle treatment changes. These changes include regular exercise, stress management, getting enough sleep, consuming less alcohol, and not smoking. Some pharmacological therapy approaches include hormone therapy, estrogen therapy for menopause, localized estrogen, such as tablets, creams, and vaginal rings, 80, which is a pill that helps increase sexual desire, or Vyleesi, which is a shot that helps promote arousal as well as sexual desire. Next, we're going to talk about female sexual arousal disorder. Female sexual arousal disorder is when both the genital and mental response to sexual stimulation is lacking or absent. Some of the causes that can happen with female sexual arousal disorder include prolonged illness, loss of genital feeling, depression, hormone imbalance after childbirth, menopause, birth control medication, and relationship issues. Some treatment options for this is sex therapy, couples therapy, changing and/or stopping birth control, checking medication side effects, Viagra, Wellbutrin, herbal treatments and/or supplements, as well as different types of hormone therapy. Next, we're going to discuss orgasmic disorder. This is where females have little to no success reaching orgasm during arousal. Specific criteria for diagnosing female orgasm disorder in women are: a woman rarely or never is able to orgasm even when sexually aroused. Symptoms last for 6 months or more. The problem causes significant distress and problems in their relationship. Orgasm difficulties are not exclusively caused by another condition or medication. Some of the causes of this condition include medical conditions, which can include but are not limited to spinal cord problems, arthritis, chronic illness, and stress. Medications such as antidepressants or SSRIs. Some psychological factors include stress, anxiety, depression, and fatigue. Relationship problems can also factor in, as well as cultural views and religious views. Treatment options for FOD include sex therapy, sensate focus, which involves a series of exercises that focus on both non-sexual and sexual touching to improve intimacy and understand what procedures pleasure in each partner. This also includes communication. For example, expressing to your partner what you need from them. Experimentation sexually, try something new. Imagination and/or fantasy. Get creative, try some role play, as well as changing your expectations. This is when you shift the focus to be on mutual intimacy and pleasure instead of orgasm and completion. Next, we're going to talk about the female sexual pain disorder. Genital pain during or after sexual intercourse. Some symptoms include sharp pain during sex or at entry during sex, deep internal pain during thrusting, aching or throbbing after sexual intercourse, muscle spasms or muscle tightness, pain and pain in the bladder. Some medical conditions associated with female sexual pain disorder include endometriosis and skin disorders such as dermatitis, as well as pelvic floor dysfunction, bowel problems such as IBS, Crohn's disease, and ulcerative colitis, bladder issues such as UTIs and interstitial cystitis, as well as hormone changes. And interestingly enough, also vaginism. This is involuntary spasms in your vaginal muscles, often caused by fear of being hurt or of prior trauma. Some treatment options for this condition include pelvic floor physical activity exercises, CBT, cognitive behavioral therapy to challenge negative thought patterns and distortions, medications such as antivirals, antibiotics, or antifungals to treat infections, different types of hormone therapy, sexual lubricants during intercourse and moisturizers, as well as sex counseling and psychoeducation on the female body. And as a last resort, there are surgical options available. And these are my references. Next, we're going to look at a YouTube video to pertain to our sexual pain clients and do a 5-minute pelvic floor release.
5-minute release video for your pelvic floor and hips today. So let's get right to it. We're going to begin on our backs, lying down. And I want to tell you a trick. If you only have a short period of time to begin releasing, one of the most effective ways is to actually gently activate your muscles that you're going to try to release first. And I'll tell you why in a sec. So here's the first move we're going to do. We're going to fire up our core and our pelvic floor and our hips by bringing our knees apart and then exhaling and bringing them together. So as you do this, I want you to just feel that as you bring your knees together, you can feel that pelvic floor, inner thighs, and just the center line of your body kind of firing up and activating. Now, I know that we're trying to release these muscles today. Keep going, by the way. We're trying to release these muscles today, and we will, but we first need to find the opposite of what we're trying to do. So the opposite of what we're trying to do is this activation, and that'll make it easier to release. So now keep the knees apart, and we're gonna do a little more activation. Tighten up your butt muscles, engage your glutes, and lift up off the ground. So hold it here, and you can have your hands on the ground and pulse it up. Pulse, pulse, couple more, and then just hold it. Now from this position, staying nice and active, you can feel your butt cheeks active, everything's turned on. I want you to actually tip your knees toward the right, and then come up to the middle and keep breathing, and then toward the left. You're really active through your butt cheeks. Tip again to the right and left, and you can feel this in your inner thighs too. Breathe steadily. One more tip, and come back to the middle. Hold it, and 5 more pulses. And 3, 2, 1. Okay, that's enough activation. Come on down. So we know what we don't want, which is that activation. Let's go ahead and stretch and release now. Take a deep breath and pull the left knee toward your left shoulder. Now, you can have your left elbow on the ground and just be holding on to your shin area or your knee and really bringing that knee up toward your shoulder. And on this side, on this leg, If you want to have some pillows or a yoga block under, that's okay. If it feels too much to have your leg dangling out here, support it. But just take a minute to breathe deeply as you pull that knee toward your shoulder and your armpit area. Releasing the pelvic floor and just breathing. Totally letting go. Now, bring the flopped open leg up and hamstring stretch. So hold on behind your thigh and pull the leg toward you. You can also hold on behind your calf, and we're just going to be here for a moment. Flex and extend your ankle. And then let's go into a figure 4 stretch. So bring that ankle on top of your other thigh. So just above your knee, you have that ankle down, and hold it right here. If you want a little bit more, let's add a twist. So this flat foot here, this is going to drop down toward the floor. And try to keep your shoulders on the ground. Hold it here. Or if you want, this is my left leg. I'm going to use my right hand and press outward against the inner thigh. And just open up the hip. Breathing deeply and letting go. Blow out all the tension. Breathe into the pelvic floor, breathe into the hips, and then let it go. Okay, release, and then let's go ahead and go into the other side. So now we have the right knee moving toward the right shoulder, the right armpit area, pulling it up, and just breathe. Again, if it's too much, you can either straighten this left leg out a little bit more, or you can prop it up with a blanket or pillow or yoga block, so it doesn't feel like it's dangling out in space. And just hold this here and breathe into the pelvic floor, releasing. Let go of any tension, any strain. And now let's straighten up that flopped open leg and straighten up this leg too, and we'll go into a hamstring stretch just for a moment here, not long. You can flex and point your ankle, breathing deeply, feeling the spine straight along the floor, stretching that leg toward you, maybe even pulling around your calf. And then place that ankle on the opposite thigh, just above your knee, and hold it here. Maybe this is enough, or if you want to bring that flat foot down toward the floor, you can, and add this twist. Shoulders stay on the ground, puff up your chest toward the sky, and then exhale, bring that right shoulder down toward the ground. If you want even more, bring your left hand up and press out against the inner thigh. Feel that opening of your hip and breathe deeply. Breathing into the belly, the pelvic floor, and then exhaling it all out. And release. Now, if you have time for one more stretch, Happy Baby is one of the best stretches you can do. And you can either just hold on behind your thighs and bring your knees up toward each armpit, or if you want the full pose, you go between your legs, hold on to the outside of your feet, and lift your feet up toward the sky and pull down. This Happy Baby stretch is one of the best ways to really stretch and open your pelvic floor. And so if you have time, stay here for as long as a minute. You can even rock back and forth. But we'll just stay here for maybe 1 or 2 more breaths before we move on with our day. So let's wrap it up. Let out any tension. Try to keep your chin tucked in and not jutting up like this. And release down. Again, you can hold that last pose for longer if you have time. But if you need to move on with your day, then just press yourself up. And I want to let you know that in the notes for this video, I'll put in some standing release stretches that are really great that you can do anytime throughout your day. And also, if you're looking for a guided program to help you with your pelvic tension and pain, there's a link to my Overcome program in the notes as well. So check that out, and until next time, remember, eat clean, move every day, and you will shine brighter. I'll see you next time.
All right. Well, thank you so much for taking the time to go over some of the women's sexual health and difficulties with me. We went over a few of them, and we did an exercise today on a 5-minute pelvic floor release to help with that pain during sexual intercourse. So I hope you have a good rest of your day, and thanks for watching.